Hello and welcome back. We are at the 48th Annual Conference of Endocrinology Society of India, ESICON 2018. Ladies and gentlemen, we have been listening to our experts and we have one more right here with us, live with you all at ESI TV. Well, ladies and gentlemen, we have Dr. Sailesh Lodha with us, hailing from Jaipur. डायबिटीज़ डरे नहीं स्वस्थ रहे के ऑथर है. आइए जानते हैं उनसे. Sir, you hold a special interest in diabetes type 1. So let us have some insights to begin with on diabetes type 1 in children.
Type 1 diabetes is precisely the diabetes of children, but it can also occur in adults, and this diabetes can start at any age, right from early childhood, adolescence, and even at the age of 25 or 30. The difference between type 1 and type 2 diabetes is that type 1 diabetics, they need more care, they need insulin for their survival throughout their life, and that is why a lot of support from the family, support from the doctors is always required. And this year's theme of World Diabetes Day is again support of the family and to the type 1 diabetes. It is emphasizing more on that aspect. So type 1 diabetics are treated with insulin throughout their life, and that is why we need to support them.
Sure, sir. And rightly mentioned, we're talking about family support, I'm sure, and even we had other faculty members who've spoken about diabetes type 1, and what we've understood largely is that they face a lot of social issues. So now let's talk about the care plus control measures. What needs to be taken care of? Where are we lacking? How do we improvise on same?
Because a child who is injecting insulin 2, 3, 4 times in a day, it becomes very monotonous and actually it is not painful, but it sounds very painful that you take insulin injections 3 or 4 times in a day. But with the use of recent technology, the insulin injections, the needles are so fine, they are absolutely painless. So this has to be taught to the patients that how they can inject painlessly, and family should be again counseled that this is not going to be harmful. If they take insulin properly, they are as good as any other individual in the family or in the world. They can achieve their targets, they can reach at pinnacle of their career with diabetes. So diabetes is never going to be a hindrance in the career. That message has to be taught to the family.
Dr. Lodha, would you like to tell our audience or share an experience, one of a kind, rare case experience that you've witnessed anytime in recent time?
Yeah, in last few years I have encountered few rare varieties of diabetes. One of them is Wolfram syndrome, for which I was talking here. Wolfram syndrome it's a sort of very complicated and crippling kind of disease. So it needs more support from the family, more support from the society for these children, because these children not only they develop diabetes, along with diabetes they develop problems with the eyes, problems with the hearing, problems in nervous system. So they may have difficulty in walking when they grow up in their 30s and 40s. So that is why we need more research in this area. Until now there is no cure for this particular syndrome, Wolfram syndrome, except that we can treat diabetes with insulin. Rest of the things like problems of the eyes and problems of hearing, we don't have any cure for or no relief in those symptoms. So we are trying to find out some clue how we can help these children with this syndrome.
Sure. Lastly, before we conclude this conversation, sir, one keynote giveaway message to our audience up here. Could be something from the talk that you've just mentioned about, and considering ESICON 2018.
Yeah, I would request all my colleagues, endocrine colleagues, that whenever you see a type 1 diabetic whom you think is type 1 diabetic or a child with diabetes, always keep an high index of suspicion if there are visual problems, if there are problems of hearing, or if there are some nervous system related problems, autonomic dysfunction. Always suspect Wolfram syndrome, and investigate in that manner.
Thank you, Doctor, for joining in with us here on ESI TV. Thank you.